First step is identify the patient. Good morning, ma'am. Ma'am, may I know your name, ma'am?
Angel Miss Perela po.
How about your birthday, ma'am?
January 15 po.
Where are you from, ma'am?
Batu, Rizal, Cagayan.
Next step is introduce yourself and explain the procedure to the patient. Good morning, ma'am. I am Carlias Perela and I am your nurse for today. I'll be assessing your head, neck, eyes, ears, nose, and mouth. Is it okay with you, ma'am?
Opo.
Next step is perform hand hygiene. Next step is use clean gloves if necessary. Next step is provide privacy by closing the curtains or the doors. Next step is observe the size, shape, and contour of the skull. Next step is observe the skull in several areas by separating the hair in various locations. Next step is palpate the head by running the pads of fingers at the entire surface of the skull. Masakit po ba, ma'am?
Hindi po.
Next step is observe and feel the hair condition. So, the patient head size is normal, hair is normal, and it is smooth to the touch. And there is no presence of lesions, dandruffs, and any lice. Next is we'll be assessing your face, ma'am. Observe the face for each shape. So, the shape of the face is oval and there is no involuntary muscle movement. Next is inspect for symmetry. Ask the patient to smile. Ma'am, can you smile for me, ma'am? So, the palpebral feature seems to be symmetrical and normal. There is also presence of nasolabial folds symmetrical on the both left and right side. Next is assess the sensory function. Ask the patient to close their eyes. Ma'am, can you close your eyes, ma'am? And next is run a cotton over the forehead, cheek, jaw of the both sides of the face, and ask her if she can feel it and where she can feel it. Maaari niyo po bang sabihin kung saan ko po idadampi yung cotton sa mukha niyo, ma'am?
Opo. Sana ako po. Ito po. Ito po.
And next step is check the corneal reflex using cotton wisp. So, the patient's sensory function is normal and the corneal reflex is also normal. Next is assess the motor function. Ask the client to chew or clench the jaw. Ma'am, can you clench your jaw for me, ma'am? So, the client was able to clench with strength and force. Next step is assess the facial sensory function. Place a sweet, sour, salty substances near the tip of the tongue.
Asukal po. Asin po. Kalamansi po.
Next, so the patient was able to identify the different tastes of substance, and that is normal. Next is assess motor function. Ask the patient to smile, raise eyebrow, close eyelids, and puff the cheeks. Ma'am, can you smile for me, ma'am? How about close your eyelids, ma'am? How about frown your eyebrow, ma'am? And puff your cheeks, ma'am. Thank you, ma'am. So, the findings of this was normal. The motor function was all normal. Assessing eyebrows, eyes, and eyelashes. Inspect eyebrows. Eyebrows are black, symmetrical, and evenly distributed. Next is inspect for the eyes. Eyes are evenly placed, non-protruding, and both eyes are black and clear. Next step is inspect for the eyelashes. Eyelashes are black, evenly distributed, and turn outward. Next is inspect the eyelids for position and symmetry. Eyelids are symmetrical and color is the same as the surrounding. Next is palpate the eyelids for the lacrimal glands. Slightly slide the pad of the index finger against the client upper orbital rim. There is no palpable mass or pain or tenderness. Next is palpate the nasolacrimal duct to check for obstruction. Press with the index finger against the client's lower inner orbital rim at the lacrimal sac, not against the nose. There is no blockage, and that's totally normal. Next is examine the palpebral conjunctiva, averting the upper eyelid. Ask the patient to look downward but keep eyes slightly open. Gently grasp the upper eyelashes and pull gently downward. Place a cotton tip above the eyelid margin and push it gently downward. And to position it normal, ask the patient to look up and to blink. Ma'am, can you look up, ma'am? And blink for me, ma'am. Thank you, ma'am. There is no swelling, infection, and no presence of foreign object. Sclera are white and also clear. Next step is inspect for cornea by directing a pen light obliquely from several positions. It is transparent, smooth, and shiny, and that's totally normal. And anterior chamber and iris are, and the details of the iris are visible, which is normal. Next is examining the pupils. Test for papillary accommodation. Ask the patient to stare at the objects across the room, and then ask her to fix her gaze on your index finger, which place 5 inches from the client's nose. Thank you, ma'am. Pupils are round, symmetrical, constrict, which increasing light and accommodation. And next is the optic nerve is assessed by testing for visual acuity and peripheral vision. Visual acuity is tested using a Snellen chart. Only one eye should be tested at a time, and the other eye should be covered with the eye cover. And make the patient read the chart by pointing at a letter randomly.
D, E, F, P, O, T, E, C.
Sa kabila naman po, ma'am.
D, E, F, P O T E C.
So, the visual acuity measurement is 20/20, which means normal. Next is assess the visual fields with the client sit or stand opposite each other and hold an object such as pencil and gradually move it from the periphery of both directions horizontally and from above and below. So, the patient visual field is 180 degrees, which is normal. Next is we're going to assess your ears, ma'am. Inspect the auricles of the ear for parallelism, size, position, appearance, and skin color. Auricles are symmetrical and has the same color with facial skin. Next is palpate the auricle and the mastoid process for firmness of the cartilage of the auricles. Auricles are firm and not tender. Next is inspect the ear canal for color, presence of cerumen, discharge, and foreign bodies. Ear canal are pinkish, clean, and there's no fusilia. Next is for children, pull the pinna downward and backward to straighten the canal. And next is we're going to assess your nose, ma'am. Inspect the external portion of the nose for placement and symmetry, and also the patency of nares. The external portion of the nose was placed in the midline and it is symmetrical and also patent. Next is displacement of bones are normal and there's no signs of tenderness and mass. Next is inspect the septum and nasal mucosa by directing the light of the pen light. is straight and nasal mucosa are no signs of swelling. Next is examine the paranasal sinuses by palpating the both cheek simultaneously and pressing the thumb below the eyebrows. There is no tenderness and lesion at the frontal and maxillary sinuses. Next is test the adequacy of the olfactory nerve. Ask the client to close her eyes and occlude. Place an aromatic and easily distinguished. Next is ask the client to identify the odor. Each side is tested separately. Ma'am, can you close your eyes, ma'am? Maaari niyo po bang sabihin kung ano yung naamoy niyo, ma'am?
Pabango po.
Ito po, ma'am.
Alcohol po.
Ito po, ma'am.
Alcohol po.
Ito po, ma'am.
Perfume po.
Thank you, ma'am. Patient can identify the different odor so the olfactory nerve are normal. Next is we're going to assess your mouth, ma'am. Inspect for symmetry and surface abnormalities, color, and edema. Mouth is pinkish and symmetrical, and there is no sign of edema. Next is palpate the temporomandibular while the mouth is open wide and then close for crepitus, deviations, and tenderness. Can you open your mouth wide, ma'am? Can you close it, ma'am? Thank you, ma'am. It is normal and there's no sign of tenderness in it. Next is inspect the gums for the color, bleeding, and retraction of gums. Can you smile for me, ma'am? It is pinkish and there's no sign of bleeding and no retraction of gums. Next is inspect the teeth for numbers, color, dental caries, alignment, and tooth loss, and also breathing. Can you open your mouth, ma'am? Thank you, ma'am. There are 28 permanent teeth and there are presence of caries and tooth loss. Next step is palpate the tongue for the texture and inspect the color, lesions, and movement of the tongue. Ma'am, can you stick out your tongue, ma'am? Can you feel pain, ma'am? So the tongue seems to be no swelling, no pain, and no presence of lesions. And the tongue is in the midline of the mouth. Next is inspect the uvula for color, for the position and color. For the vagus nerve, it is tested by asking the patient to say a note. The uvula will move upward and forward. Can you say ma'am? Can you stick out your tongue, ma'am? Ma'am. Say ma'am. Ma'am. Say ma'am. Uvula is at the center, pinkish in color, symmetrical, and it is freely movable. Next is we will be assessing your neck, ma'am. First is palpate from the forehead of the posterior triangle of the neck for the posterior cervical lymph nodes using finger pads in a circular motion. Are there any pain, ma'am? So, patients do not comply any pain or tenderness. Next is inspect and palpate the front and behind the ears, under the chin, and the anterior triangle for the anterior cervical lymph nodes. Are there any pain, ma'am?
Wala po.
So, patients do not comply any pain or tenderness. Next is inspect and palpate the left and right carotid arteries. Only palpate one carotid artery at a time. So, carotid artery is normal. Next is inspect and palpate the trachea. Trachea is centrally located at the midline of the neck. Next is palpate for the carotid gland. So there's no sign of tenderness and masses. Next is inspect and palpate the supraclavicular area. So, the supraclavicular area is both normal. Next is inspect the ability of the patient to move their neck. Ask the patient to touch her chin to chest and to each shoulder and each ear to the corners corresponding shoulder, and then tip of the head back as far as possible. Ma'am, can you do this, ma'am? Sa kabila po, ma'am. Dito po, ma'am. How about this one? Sa kabila po, ma'am. Back po, ma'am. So, the patient could do it effortless with no pain. Next is perform hand hygiene, and before that remove already your gloves. After assessing your head, ears, nose, mouth, and neck, all findings seems to be normal and no complaints of any tenderness and no abnormalities, ma'am.
Thank you po.
Yes.